Welcome out there in television land to the fastest 30 minutes in television. Philip Benyo with Philip Benyo, also known as the Flipster, bringing you the latest up-to-date information on your health care. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back after this brief commercial message. Welcome back to the first segment of It's Your Health. You know, before we start, I just want to give a shout out to those out there who got us through a troubling time for the Benyo family. July was sort of a twisted time when Phil lost his mother, my younger brother, and although we didn't have public funerals and visions and those types of things, there was a tremendous outpouring that was graced to us between cards, letters, mass cards, flowers. So thank you so much for remembering these two loved ones. So moving right along.
Remember, anything you hear on this show, you definitely want to check with your healthcare practitioner before you try.
All right.
Anything.
Anything.
All righty. Let's start with some headlines.
Let's do that.
The American College of Physicians guideline backs the use of bisphosphonates.
Yeah, I'm not a fan of those. Those are treating osteoporosis or thinning of the bone. Oral agents like Fosamax. I'm not necessarily a fan of those because they create a lot of esophageal issues for people that have reflux symptoms, for example. However, the article did go on to say good things about Prolia, which we use quite a bit. It's a shot that is given twice a year. And we've really not seen a great deal of side effects from this. In fact, people who have had DEXA scans, which measure osteoporosis, after a couple of years of Prolia, they actually have improved bone health and T-scores, which is kind of revolutionary. But the main thing is get diagnosed and treated for osteoporosis.
All righty. The U.S. Preventative Services Task Force discourages postmenopausal hormone use.
Yeah, I'm not sure that's brand new news. It's kind of fallen out of favor. We used to put many women who were postmenopausal on estrogens for a lot of good reasons. At least for symptoms, it prevented osteoporosis, created less hot flashes, improved cholesterol types of things. But nevertheless, it's something that is obviously fallen out of favor because of the cancer risks and cardiovascular risks, so we don't use them.
Studies show the effects of yoga improve asthma symptoms.
That's interesting, Phil. I'm not too familiar with yoga. Maybe you can take us to that level.
Well, yoga is an exercise that you can certainly do that helps you learn how to breathe properly. It also has a fair amount of cardiovascular work, depending on what kind of flow or classes you go to. But they actually studied it, and they showed that yoga helps not only improve your symptoms of asthma, but also decrease medication use and improve your quality of life. I personally go to yoga once a week or every other week with Casey Gillespie, and she does a wonderful job of getting you through the flow. And let me tell you, it's work, but it helps improve your flexibility and stamina.
And no side effects.
No side effects, absolutely. Alrighty, this is a topic I know that you wanted to talk about, and it's something we hear a lot about. People come in and say, I want my thyroid checked, I want my thyroid checked. I have people that we check it almost every month because they feel tired, they're gaining weight, and there's a variety of things that make them think that they may have a thyroid problem. We do the blood tests, TSH looks normal, the free T4 looks normal, yet they still think they have a thyroid problem. Do you think there's something going on?
You may be referring to subclinical hypothyroidism, which is a small number of patients who have this. They actually do have a low thyroid state. It's just perhaps not showing up in conventional routine blood work. What would you recommend?
Well, take a look to make sure there aren't any other things going on. But there's a blood test we can do called thyrotropin, which is a little bit different type of a blood test that does vary a lot throughout someone's year or life. There are some conditions that can mimic it and put us in this subclinical hypothyroid state. You know, the key is now we're going to start medication that has potential side effects for a condition that we can't quite prove. Depending on that person, we can, and how their blood work looks out, we can think about putting them on some low-dose thyroid replacement and reassess them in 3 to 4 months and see how they're doing, see how their labs look, and see if they feel better. If they don't feel any better at all and their labs are really unchanged, they don't have subclinical hypothyroidism, and probably they have some other problem going on. And so we need to kind of look into that. But that's certainly something that we do run into, because it's quite common to hear this complaint, but I haven't really had a blood test that I could hang my hat on to look into it further.
Right, exactly. And I guess the question is, it has to start somewhere. And so before a condition becomes clinical, which means causing symptoms that we can treat, it could be subclinical. It's kind of under the radar.
All right, another interesting topic, the effects of statin use in elderly to prevent dementia or vascular type dementias.
Well, I'm sort of a fan of statins. I think they're revolutionary drugs, not for everyone, but for some selected patients, they have anti-inflammatory properties on the cardiovascular system, obviously reduce cholesterol, plaque formation, and it may, especially since there's a subset of dementing illnesses that are vascular, it may very well prevent these type of illnesses. But when you go on the internet and you hear all these side effects of statins, people are kind of gun shy because they can sometimes create things that perhaps they don't want from a drug. Is that pretty much it?
I think the real key is if anything, this article harkens to that we need to treat these disease states early. If we wait till we're 85 years old and we're having problems, I don't have a pill to reverse time. Those plaques are going to be there. They're really not going to go away. They're calcified. But when you're 45, and if you have a history of vascular illness and you have risk factors for vascular disease, you should be treating these things aggressively, because this is not something you can just turn back time, or turn back the clock. We need to get people on the medication early, because the studies have shown in more elderly populations, starting statin use really is kind of a little too late. So we need to think about using these things earlier. So and think about statins as not really treatment, but think about them as prevention.
Yeah, no doubt. I really think that's right, Phil.
All righty, I got a neat picture here for you.
It looks a little rough.
All righty, so this person's a smoker in their 50s, came in with fever, went to the ER, had elevated white blood cell count, and when the doc went to kind of look in their mouth, they saw this.
Yes, the black hairy tongue. And what's interesting is this particular case was reversible, probably due to the illness that they had. But there is a condition called black hairy tongue, which doesn't kind of go away. It's more of a pigment problem with the tongue. I think if you have black spots or brown spots anywhere that are not going away, they should be looked at, whether they're on your tongue or not. Yeah,
the blackness in this case really is because they're a smoker. But often this respiratory illness, you're going to see a desquamation of the tongue and some overgrowth of tissue. But they were on antibiotics for a few days and it just went away completely. But if that's what smoke does to your tongue when you're sick, imagine what it does to your lungs. So we got to lay off the smokes.
Well, we'll be right back after this brief commercial message. We told you it's the fastest half hour in television history. We'll be right back. We're It's Your Health, your leader in healthcare information. Welcome back to the second segment of It's Your Health. Philip Benyo with Philip Benyo, bringing you the latest and greatest. Right, Flipster?
Right. All righty. So a couple more headlines, which should make pretty easy sense, but yet we have to have a headline about it. Trans fatty acid restriction in New York City is linked to lower hospitalizations for MI and stroke. Who would have thought?
Yeah, what is a trans fatty acid, by the way?
Well, there's when we think about saturated fats, we have cis and we have trans. The trans fatty acids are the ones that actually, the way the acid is linked, to the molecule's linked, it has a flip in it. So it's opposite as opposed to being on the same side. That doesn't seem like a big deal, but at the end of the day, trans fatty acids are by far the most toxic, pro-inflammatory, plaque-producing agents. And New York City, to their credit, has really taken a stand against things that unfortunately we have in society available to us all the time, and saying we're going to tax these things, we're going to make it hard. And so they have a soda tax. Now they have, and they lately have had, we're not just trans fatty acid, you're not allowed to have. So Trans fatty acid is often is found in lard, it's found in animal products and in frying products. So one of the reasons when you go to KFC, if the chicken doesn't taste quite the same as it used to, that you remember from a few years ago, it's because we're not frying in trans fatty acid. Certainly it's still not good to fry things in general, but in trans fatty acid, it's a real recipe for disaster. And in New York, they restricted it, and guess what? You know, people are healthier. I think in a few years, when they look at the taxes on soda, we're going to see less diabetes in New York. So, I mean, kudos to them for being restrictive on these dangerous things, because obviously us as individuals are not able to make, as a population, the right decisions.
And you see these on things like cookies, no trans fat. So
Absolutely.
that's what they're referring to.
That's the big thing.
So,
and it's
good.
interesting now, here in Pennsylvania, we don't have any restrictions on trans fatty acid, but you have one little part of the country, a very small part, big population make a legal change, and all the fast foods had to change their fats. You know, the only way you find something that's fried in trans fat is if you go to a mom and pop place.
Yep.
Alrighty. Evidence for medical marijuana is largely up in smoke.
You know, patients are already asking when you're going to be prescribing this. And I think for some selected patients who may have chronic pain or have issues with weight loss and loss of appetite, there may be some select few, but people are trying to get on this train. I'm not sure they're going to necessarily get where they're going to go.
I agree. You know, the problem is it's not really well studied. It's hard to study because of the government restrictions. We can't put 10,000 people on it and see what happens like we do with medications. But we have seen from recreational use what it has done. And while the evidence for all these bevy of conditions we hear about other states being treated is largely circumstantial and very small evidence-based population medicine, but we do know that it does cause problems. There's increased heart attack risk. It's smoking. And you know, a lot of people will say to me, well, you know, it's natural, and that's really what we need. And, you know, and the example of an epidemic in our area is, you know, the base drug in heroin is natural. That's derived from an opium or a poppy plant. So, you know, that's not good for you, and you know that that's not good for you. Why is marijuana good for you? I said, maybe it makes you feel good, and I get that, but there's going to be risk, and especially with daily use. And it could be even far worse than, say, something like smoking.
You know, and I recall a Harvard study that I actually attended to up in Boston, where they proved without a shadow of a doubt that the use of marijuana exposure to teen brains, adolescent brains, irreversibly changes their IQ and brain structure. And you realize that teens are going to get a hold of this stuff.
Absolutely.
And why would you want to risk that? I mean, it's just unbelievable.
Alrighty, lastly, FDA approves the first home genetic health risk kit.
What does that mean?
That means you get to sit and get a kit at home, and you get to swab your mouth, like they do on, you know, CSI, and you get to send it in, and you will get a printout, if you will, of the different genetic things that you are at risk for, you know, such as stroke, heart attack, and such.
You know, I don't know about that. It's kind of like opening a genie that you don't want out of the lamp. I mean, what do you do with that information? Do you then become a psychological cripple? Do you then become like Adrian Monk, who's kind of handcuffed in terms of trying to live life? I don't know what you do with that information.
I think it's controversial. I think if that's what you need to turn around and maybe change some of the modifiable risk factors in your life, if you're a smoker, if you're obese and you're inactive, that's the thing that's going to finally tell you, oh, I maybe get serious, then great. I think it's a wonderful test. But I don't see it really having a benefit long term to get people to change their lives if they can't listen to the things that we're doing and all the other studies out there that show you need to live a healthier life. You know, I'm not sure this test, which will probably cost a couple $100, you know, insurance isn't going to pay for that.
Right.
I'm not sure that that's going to make the big change in your life.
Well, it's interesting nonetheless.
Yes, it's available. There it is. Alrighty, moving on. Let's talk about a common, you know, patient complaint or you know, office visit is for dizziness. What do you think when someone says I'm dizzy? What things are we looking for? What are we going to talk about?
I kind of put it into certain categories. Is it dizziness when you're lying down, flipping your head from side to side? That kind of puts it in the inner ear issue. Is it dizziness when you go from lying to sitting to standing, which could be medication-induced, fall in blood pressure, dehydration, diabetes-induced? Could it be something vascular? Did you have a stroke? Did you have a brain tumor or an aneurysm? So common things occur commonly. Usually we can find out the reason you're dizzy, and it just requires a couple of things to go through our cookbook. And there are some people, unfortunately, who are dizzy all the time, and we can't really help them, especially if they have problems with the smaller blood vessels, the so-called vertebral or basilar arteries going up from your neck into your dizzy section. So I would try to seek out an answer, because usually we can find one.
Alrighty, moving on. The need for smoking cessation is greater than ever. I think the evidence is overwhelming. Yet, I've noticed over the past few years, maybe 5, 6 years ago, we were using Chantix quite a bit. And it seems to have just, for whatever reason, we're just not using it as much. And you know, there's a real call to start really pushing smoking cessation a little harder and kind of reintroducing Chantix as a way to do that. Because as far as efficacy, there is nothing that has a greater chance to get you to quit smoking than Chantix.
I think it works well, a low incidence of side effect. A little pricey, but it's less than the pack of cigarettes over a month's period of time. I think the other issue is people have to want to be able to do this. Mm-hmm. And it's like any habit. They obviously get some pleasure from it. They're not penalized because of a long-term issue. But you know, walk around the hospital or come into a nursing home and we'll show you the long-term side effects. So it's tough. And what's even more frustrating is the younger folk. It's just like they're immortal, and they feel they're not going to be penalized from this terrible thing. And I just, if they want to outlaw things, they really should need to outlaw tobacco use in this country.
Alrighty, lastly, I got a cool picture here for you to look at. Someone came in, they were coughing, they had a bad bronchitis, and they had their gallbladder taken out a few years ago uneventfully, and they come in with this bulge in their belly, and they're like, I don't know what I did. What do you think?
That looks like an outie, a belly button outie, right? Is that what that is? Little hernia?
Right. Very common. Nothing you can do to fix that other than surgery. It's not going to go back on its own. That's a piece of intestine that has escaped from the inner abdominal wall, and unfortunately, that will get bigger over time.
And the key message is, if it's painful and doesn't go back in when you push it, just drop what you're doing and go to the emergency room.
Absolutely. That can be a surgical emergency.
Right. Speaking of emergencies, we have to take this commercial break for It's Your Health. We'll be right back after this brief message. Welcome back to the third and final segment of It's Your Health. We are just zipping right along here, Flipster, with a cornucopia of information, so let's not stop now.
Vitamin D supplements fail to prevent cardiovascular disease.
Well, I don't know if that's really news. There's a tremendous epidemic of people out there who have low vitamin D levels. And whether we measure them or not, if you live in northeastern Pennsylvania, you have a low vitamin D level, I guarantee it. I think it's going to be good for bone health. It may have some other benefits as well. I'm not so sure taking it is going to necessarily improve your heart risk.
Yeah, it kind of falls under the category, you know, every few years I find, I've been working long enough to see these patterns, that the cardiologists tend to come up with these, you know, new wonder supplements. And when I started working, vitamin E was it. Vitamin E is going to decrease cardiovascular risk, decrease stroke and heart attack risk. Vitamin E was it. Everybody's on vitamin E, and we still see some people on it here or there.
Yep.
But after a few years, it turned out vitamin E doesn't do much, and in fact, it can create toxicity. And so here we are with another fat-based vitamin, fat-soluble vitamin, vitamin D. Same thing. Vitamin D initially, when it started making the big craze, there was cardiovascular circles talking about how this is the new greatest thing. It's going to help us do this and that and the other thing. And here we are, it's not working again. So I'm not sure what, we're running out of vitamins as far as from the cardiology group. But vitamin D certainly does have a place. It is, remember, a fat-soluble vitamin. You can get toxic if you take too much. So you have to be careful and have to have that monitored.
When I was your age, it was vitamin C.
Yeah, so it's right. We're running through them. I'm not sure what the next vitamin E is. Death Watch intensifies for HDL-based medications.
Yeah, HDL, of course, high-density lipoprotein, is the good cholesterol. People obviously try to increase it rather than decrease the bad cholesterol. It's a little backwards. But nevertheless, I'm not so sure it's easy to do.
Well, that's the thing this is again one of the things that we're trying to get plaques to go away, and we've been able to see people with HDLs that are nice and high, they really either don't get plaques to form, or if they raise their HDL, they get plaque regression. It's one of the things that actually helps scrub the arteries clean. So it makes sense to make a drug to do that. And they've actually made drugs very successfully that raise your HDL. Unfortunately, these drugs kill people. They increase all-cause mortality and cardiovascular death. The first drug that was going to come out was ready to come out, and it ended up killing people. They stopped it. Now the newer drugs are infusions. You have to take them every week for weeks on end, and they show they're not doing anything.
Right.
Uber expensive medication. So the idea that we're going to get HDL to artificially raise up through medication might just not work. It's one of those things we just can't modify, but you can modify it on your own. HDL, there's only one way you can get your HDL to go up, and that's intense cardiovascular exercise, high intensity interval training. These are the things that will raise your HDL. And you'd sit and you look at athletes that really push it, not just running for long distance forever, but the high intensity cardiovascular training, those are the people that have the HDLs in the 50s, 60s, and 70s, which is wonderful.
So if you want to raise your HDL, you look up Phip at CrossFit in Drums, and he'll put together a program for you to raise your HDL.
That's our goal, among other things. Lastly, longitudinal patterns of cardiovascular respiratory fitness predict the development of hypertension. This is in the no crap category as well. Who would have thought improving exercise endurance will lower your risk of a disease?
Well, yeah, and we see patients who are post-bypass surgery for their heart, and the main thing that they are given first is cardiovascular physical therapy.
Yeah, cardiac rehab.
Yep, and that's they should have did that before all this, and they would have probably avoided all this. But Phil, you're really into exercise and fitness down at CrossFit and Drums. Tell us a little bit more about it.
Well, I think it's just, again, the basic example of these guys who do cardiac rehab, they walk out there saying, this is the best I felt in years. Well, that's because they finally are up off their rears and they're exercising and doing stuff to help improve their cardiovascular fitness. It's unfortunate it took a heart attack to get them to that point. But again, these are preventable disease states that you can modify. You can take your genetics for what they are and modify it through, high intensity training. Now let's talk about some of the pitfalls of high intensity training, and one of the examples of that is like spin class. People go to spin class, but this is even something we see in the CrossFit world. You see a younger guy who's not particularly cardiovascularly fit, but he has a decent engine, and he comes out and decides to go crazy air squatting and doing all these things, and all of a sudden he starts, next day or two, he feels weak, he feels tired, his urine starts to look like Coke. What do you think was going on?
He probably burned some muscles along the way, so-called rhabdomyolysis. We usually see this in somebody else who's taking a statin, but nevertheless, these people have just burned some muscle, right?
Right, and we're starting to see that, and that's actually, as coaches, we have to watch to see someone's not at risk for that and really plan exercises so people who are new to fitness don't go and be a Joey gym class and try to be a hero in the first day or two. Those are the people that are really going to hurt themselves. And so for any type of exercise, you really have to sit and ease into it so you're not burning large amounts of muscle, because those muscle proteins will go in, they'll gum up your kidneys, they'll gum up your liver, and you end up going to kidney failure, and that can be quite dangerous. Here you're trying to get yourself better, but you really have to ease into it slightly, and this is something that can be associated with all aspects of intense exercise.
Go low and go slow.
All right, got a couple pictures here. This is the time of year to see this. I have a patient comes in, they says, oh, I'm getting hives, and she'll show me the hives, and of course they're not there. I get them along my belt line, I get them around my socks, I've been getting itchy all over, sometimes on my back, it's worse after the shower, but they come in the office and I don't see a thing. So what do we do?
What I do is I get my fingernail and I run it down their arm and wait a minute, and we then see hives, and that's called dermatographism. And that means what?
Well, that means that you have hives wherever you've touched. Your immune system is so overcharged due to some chronic exposure to allergens, and this is the time of year we see it with pollen, that even touch, you're not allergic to touch, but even touch causes a significant histamine response. And here you can see a picture of someone who did have that scratch test. And about the only thing we can do for that is recognize it's allergy-based or allergy-mediated. And The use of Zyrtec or cetrazine is something in the higher doses we can use and put people on chronically to sit and cover this during the time for their allergies, and just recognize that that's the fact.
Yeah, it's kind of impressive. I mean, they think they're allergic to my fingernail, and they're not. It's just the pressure of the skin, and the skin's ready to take a
Just
fight.
ready to go. It's
Just ready to go.
blow up.
Speaking of going, here it is again, our final segment of It's Your Health. Thank you for allowing us to be part of your health care and inform you and hopefully entertain you over this past half hour. Thank you for watching. It's Your Health, your leader in healthcare information.